for this side, that is the, which side is this? This is the right side, right? Right side of the patient. So if I want to give the injection on the right side here, I am coming from the left side. So this is the way dentist will come here. So that is the injection they will give. And if they want to work on the left side, they will go the injection from the right side. So there is cross. So that means that inferior alveolar nerve injection is always giving here. So if I ask you where is the location of the inferior alveolar nerve block, because in the lower we don't have anterior, middle and posterior. It has only one, that is called the inferior. So inferior alveolar nerve block, because it is giving the nerve fiber for every single teeth. So if I give the injections here, inferior alveolar nerve block here, it ultimately numb all the teeth. If I give the injections here, it ultimately numb all the teeth here. Because there is no other way. Because in the lower jaw, it is only one nerve. So if I give the injections here, say as for example I'm giving injections here, so even though I am working only these two, but all these tooth will lose their sensations.
Up to middle? One side?
All the middle. Oh. All the way in the middle. So if I give the injections here, so it ultimately block all the tooth nerve stimulation, because that is only one nerve here.
This is easy.
Okay, so for inferior alveolar nerve block, we are giving injections here. But that is the one which is the one of the very tricky injections, because we have to go all the way inside, and you know the here, like here we have a bone called the ramus. That is the vertical part is ramus, and then we have the body of the mandible. So that is the ramus and the body of the mandible. So in the middle here, we actually come here actually. So in the middle of the ramus, there is small bony projection inside, not outside. So that is called the lingula. And that lingula is make the guard, so nerve is coming like this. And we have to give the injections here. So whenever we go with the needle, we have to come all the way here. We are not coming here, because if we come here, I can direct the injured the nerve. So that can be go for the paresthesia. So that's why you have to come here. So dentists, when go all the way in, they feel a tug back. So when they feel something is stuck, that means they are within the bone. If they don't feel any bone, they have to change the directions. Anyway, that is the part of the dentist. So, but for you, you need to memorize that the inferior alveolar nerve block is here. That is the retromolar pad area. Okay? And for other two injections, that is called the buccal nerve block and the incisive nerve block. Okay? So buccal nerve block and incisive nerve block and the mental block. These are the other three injections we can give. So the mental nerve block, you know, that is our mental region. So premolar area is known as mental region. So if we give the injection in the mucobuccal fold like here, so that is the mucobuccal fold area of the in between the two premolar. So when you give the injection in between the two premolar, that will be your mental block or the incisive block. Okay? And we have to giving the inferior alveolar nerve block here. In the premolar region, you are giving the another injections. And then another injections for the buccal nerve block, that will be the mucobuccal fold area of the third molar. So these are the areas. So you are giving injections, one here for inferior alveolar nerve block, that is for the tooth itself. And this incisive nerve block and the buccal nerve block, that actually covered the peripheral nerve vessels and fibers for the buccal side. Okay? And usually when they give the injections here, that is the inferior nerve block, so half of the cartilage, usually half of the cartilage, they push all the way in like this, and they change the directions. So they first go like this, give the half of the needle, half of the cartilage, and then they change the directions like this. And then they push all the rest of the materials here. So that actually covered the lingual surface. There is no extra injections here. Like here, we give the buccal side and the palatal side, right? But in case of here, we are giving only one injections, go to the inferior alveolar nerve block. Then after giving the half of the cartilage, then the dentist will move it to block the lingual nerve, because here we have the lingual nerve, which keep the supply on the tongue and as well the lingual surface of the tooth. So the tongue and the lingual surface will be blocked by the lingual nerve. And the buccal side, we're giving the buccal nerve injections, and we're giving the incisive block for the incisive block injections. So first of all, we're giving one injection here, inferior alveolar nerve block, and if the dentist work for the posterior teeth, they will go for the buccal nerve block. If the dentist want the anterior teeth, they will go for the incisive nerve block. That is in between the in between the premolars. Okay, clear? So that means for lower, it is only three. One is inferior alveolar nerve block, one is buccal nerve block, one is incisive nerve block. Okay, and for upper, it is anterior superior, middle superior, and as well as the posterior superior, nasopalatal, greater palatal. And the book which I gave you last week, if you go to the page